Dr. Clark, we were just talking about how certain therapists don't think sex addiction is real, and that I would assume could have some negative consequences on clients and people suffering. What are those negative consequences, and what should we be aware of?
Absolutely. So it's like anything else when you're treating someone for a condition, for a disorder, you need to know what you're treating, or you can give the wrong treatment that could have really harmful effects. And that is true when people are trying to treat someone who is a sex addict, but the person treating them does not admit that addiction exists or that addiction is present, or simply doesn't see it because they don't know. So a couple of things about addiction, because as you know, sex addiction is about addiction, not about sex. We're not pathologizing anybody's sexual behavior. We're looking at, is this person behaving in a way that's obsessive, compulsive, out of control behavior done in spite of negative consequences to self or others? And one of the things about addiction is the control aspect. If you're in a 12-step program, for instance, for any kind of addiction, step one is admit we're powerless. In other words, we have no control because the limbic system, the survival brain, is so in control unconsciously of what the person is doing that it shuts down the prefrontal cortex, the person's ability to think. They're not even aware of what's going on. All they know is it's out of control behavior. The behavior is out of control. They can't control it. They don't know why. And when they're trying to control it, we call that white knuckling it. So if you think about, I'm not going to do this, I'm not going to do this, I'm not going to do this, okay? They're putting all their energy into not doing something. They're thinking about what they're not doing. They're trying really hard, and they're up against the limbic system. And when you have a therapist who is coming in and saying, well, you can control this, you're not doing it now, for instance, that comes across as very shaming for the person, because when that person leaves the therapist's office and they're thinking, oh, my therapist just told me that I can be in control of this because I wasn't doing it in their office. And then they leave the office. And then what's the first thing they do? They act out. They go do it because they're not in control and because the therapist didn't work with them on what's really going on. There's just, and that's going to be shaming. You know, the person's going to feel very shamed because now, oh my goodness, my therapist told me I was in control, but clearly I'm not. So what's wrong with me? And it just misses the whole point. When someone's an addict, they really need to heal the trauma from childhood that led to them experiencing the pain of disconnection that I talk about in other videos, that pain of disconnection that leads to filling up that hole in oneself with whatever the drug of choice is, whether it's a drug or a behavior. Behavior could be some sexual activity, but it's filling that up. It's doing something to relieve pain. And when a therapist doesn't recognize that, they're not going to heal that pain. They're not going to do anything to heal that pain. And the person's going to continue to experience that pain as they're struggling to be in recovery, as they're struggling not to do whatever the behavior is. People also need to understand the way the brain works, the prefrontal cortex and the limbic system, and get that education about addiction. And so if a therapist thinks it's not an addiction, the person's not an addict, they're going to completely bypass the whole educational process of what addiction is, how it works on the brain, what's going on for the addict. And I've just seen so many people harmed by this who come in to see me and they've been struggling with this for years and they've been in therapy and the therapists were just either clueless or out and out anti-sex addiction and trying to treat it in another way. And it just leads to continued suffering. Thank you.
Thank you.